joining us for this important webinar. This webinar, which we have titled From Data to Action, Strengthening Women's Health Rights and Access to Services. I want to recognize the presence online also of the Executive Director of the Alliance for Reproductive Health Rights, Ms. Vicky Okai, who is kindly hosting us here. I also want to recognize the presence of three very important women who are coming to share their insights with us as part of the celebration, and I will get to them in a little while. Why are we having this webinar? It's all about 2025 International Women's Day, which was celebrated or has been celebrated with the theme for all women and girls, rights, equality, and empowerment. Those of you who are familiar with ARHR or Alliance for Reproductive Health Rights will know that for the past 2 decades, we have been concerned about women's and girls' health rights, amongst others. Indeed, we have lately been working on the gaps in health systems for gender and intersectional sensitivity. If indeed we are promoting universal health coverage and primary health care for all, the gaps are weighted heavily against women and girls. Some of the concerns have been distances to be able to access facilities, access to essential medicines, privacy concerns, and even resources to pursue their health needs. People suffer from multiple vulnerabilities at the household and community levels there are concerned. And so ARHR and our partners have been working on an initiative to achieve more gender responsive and inclusive health systems and to enhance access based on gender equality. So this year's theme, rights, equality, and empowerment, speaks to us. It's about realizing women's rights to health, fostering equal opportunities to primary healthcare facilities and resources, and empowering women as patients and clients, but also female health providers to be able to have the health services that we want. ARHR has worked with this endeavor with our partners, including Send Ghana, Song Taba, Youth Alive, GLOA, and members of the Alliance. And we've started our work at the family, community, and institutional levels. So today, what do we want to do? We want to be able to share with you some of our work in that area and engender some discussion. We have conducted a study, a baseline study across 18 districts in 7 regions of Ghana around these concerns. And we also want to share these findings. We have invited some key resource persons who, by the wealth of knowledge and experience they have and where they sit, will be sharing their insights with us. And from the arising issues, we can hopefully chart some pathways, identify some pathways to move from data and talking to action. So what are our objectives? The objectives of today's meeting are to disseminate the findings that we've made from the 7 regions on gender-empowered dynamics in primary health care and health access at the family, community, and institutional level. The second objective is to discuss the arising concerns relating to women's and girls' rights in primary health care and pathways to equality and strategies for empowering women and girls. From all of this, we are hoping to be able to generate some proposals on action or moving to action to strengthen women's and girls' rights at the national, subnational, and community levels. So what do we have? In a little while, I'm going to invite my resource persons, each of them, to make an introductory statement from their perspective. Then from there, we shall invite Mr. Benjamin Okonkmeti, Program Manager, Policy Analysis and Advocacy at ARHR, to share with us the findings for about 20 minutes. Then we will have a chat. My ladies have termed it a fireside chat, but because it's in the daytime, I want to call it a tableside chat. And my resource persons will comment on various aspects of the issue. Then we'll open the lines and we will get some input from you, our dear audience, stakeholders, and participants. We are hoping to bring all of this to an end by 11:30, God being our helper. So before I tell you who our resource persons are, we are eager to know who's joining us. We would like you to introduce yourselves. Please indicate in the chat boxes, your chat boxes, who you are and where you are participating from, and anything else that you would like us to know. I didn't introduce myself. My name is Esther Fair-Apache. I've been associated with Alliance for Reproductive Health Rights for several years. I've been on their advisory board, and I'm also providing some technical backstopping on this assignment. Now, who are joining us in this regard? Ladies and gentlemen, I am deeply privileged to introduce three awe-inspiring people who will be giving us the benefit of their insights today. It is with great pleasure that I introduce Maribel Okine. Maribel has been director of the Department of Gender in the Western region for a number of years. She's doing some fabulous job work, fantastic, engages on radio, on TV. People know her, and she's doing a great job. Maribel, you are very welcome.
Thank you, Ma.
Yes, indeed. Very proud of you. I'm equally proud of Hajia Lamnatu Adam. As for Hajia Lamnatu, if I begin, I won't finish. She's the executive director of Sankaba. She's doing amazing work, gender-related issues on the ground, poverty, engagement, tracking the use of women's time, the multiple concerns, intersectional issues, all of these things. And lately, they've been piloting ways of looking at local resource mobilization and empowerment of community-based entities. Hajia Lamnatu, with whom I am well pleased. Can you greet my audience? Hey, Hajia. Okay, she's somewhere in the system. I've seen her this morning. Yes.
Yes, good morning, everybody. Glad to be here.
Great. Then finally, I want to introduce to the House Madame Mavis Adopia Bochi. Mavis is a gender focal person at the Ministry of Health. She's worked very hard in the past 1 year. She has managed to pull all of us to the table to finalize the Ministry of Health's gender and health policy. Very interested in the subject, knows the issues, also knows governmental systems and how they work, and how we're going to prioritize health for women and girls in the years ahead. Mavis, Auntie Arubia, you want to say hello to the audience?
Yes, hello everyone and good morning. I'm glad to be here to be part of this important meeting. Thank you.
Thank you very much. Right. So now I have finished. I'm going to get my ball rolling. I'm going to invite, first of all, Maribel, I want you to make a brief statement, a 5-minute statement on the issues I want to discuss, the celebration of the International Women's Day, and why health and women's access to health at various levels is important. Maribel.
Okay. Thank you very much for the opportunity. So, as the department and at the Ministry of Gender, Social and Social Protection, we say kudos to Alliance for Reproductive Health Rights for this initiative. As a department and at the ministry, we believe so much in working with collaborators from academia to every side of the economic area. So we are happy for this initiative by Alliance to link the celebration of International Women's Day to our health. If you all know, 30 years after Beijing, Ghana still have a lot to do when it comes to issues of health. When it comes to the Ghana's performance in the 2024 Global Gender Gap, which highlights the gap that we need to address. Though Ghana has scored 95.6% in health and survival, there are still issues of improvement that needs to be done on equal access to healthcare services for women and girls. As a country too, we need to bridge the gender gap in well-being and survival. You will ask why. We have 95.6% as our score as of last year. But then these are some of the issues. We need to increase access to healthcare, increase access to healthcare services, particularly in rural communities. When it comes to the Western region, there are places where there are issues we have to handle. And I believe we still have same in other parts of the country. When it comes to quality health care, there are issues there that we also have to handle. So the Department of Gender, which is the implementing arm of the ministry, we are happy for this collaborative venture with Alliance, and then we are hoping that we work together to address the dynamics that perpetuate gender inequality and empower women and girls to control their own health and well-being, because our health is a vital thing we have to work on if we want to be empowered to national development. So I've mentioned that for 30 years, we still have gaps we have to address when it comes to health. The role of the department is basically to conduct building partnership, collaboration, and advocating for policy change and training and capacity building.